Okay, let's go ahead and start. Thank you for joining us this afternoon. My name is Javier Becerra, Attorney General for the state of California. I am pleased to be joined by Assemblymember Jim Wood, the representative for the 2nd Assembly District here in California. We're going to talk about some important stuff today, and I want to start off by reminding you of August 10th, the importance of August 10th. If it doesn't flash in your memory as quickly as it should, then let me remind you of what happened on August the 10th, at least what happened August the 10th of 1921. That's the year and the day that Franklin Delano Roosevelt, not yet president, but age 39, experienced his first symptoms of polio, which today we don't think too much about because we have vaccines that make it possible for all of us to make sure that our children don't experience polio and the effects of polio. We don't think about it a whole lot, but for medicine and some of those drugs that we use, life would be very different for a lot of us. August 10th is also very important for another reason. On August 10th, 2015, an individual by the name of Martin Shkreli acquired a company which owned a drug called Daraprim. It was a drug that is used to treat malaria and parasites. It's a very important drug because for many people it means the difference between life and death. Before August 10th of 2015, the price of Daraprim was $13.50. After Mr. Shkreli had acquired Daraprim, the price rose to $750. That's a 5,455% increase over the price literally overnight for life-saving medication that people need. Mr. Shkreli took advantage of having little competition in the pharmaceutical industry, and he hiked up the price of what is a life-saving drug. Mr. Shkreli made the news. Much more common than what Mr. Shkreli did are what we call pay-for-delay agreements. They happen behind closed doors, and consumers pay for it. But these secrets that are reached behind closed doors through these agreements rarely make the news, at least not as quickly as they should. In these agreements, a company that makes a name brand drug will enter a collusive agreement with a company that makes a cheaper generic drug. The generic drug maker agrees to keep the lower price version of the drug off the market for a certain period of time. As a result, the price remains high. Take the case of Cipro. That's a commonplace antibiotic. Its manufacturer, you'll recognize the name, Bayer, held a patent on that drug that was set to expire in 2003. So what Bayer did was it reached a deal with many of its rivals. It paid them $400 million to keep their generic drugs and that competition out of the market for an additional 6 years. During those years, Bayer was able to raise the price of a single pill of that antibiotic, Cipro, to $5.30, and in some cases even more than that. But by 2015, with no agreement in place to delay the entrance of generic drugs, the price of a pill like Cipro was 17 cents by 2015. There are drugs in your medicine cabinet today with similar stories. Lipitor, that's a leading cholesterol lowering drug. When the drug went generic, its price fell from more than $5 a tablet to 31 cents a tablet. The price essentially was 1,600% higher than before its generic competition required there to be a greater transparency on the price. As anyone here who's been to a pharmacy lately can tell you, the cost of prescription drugs is not going down. They're going up. And they are a major reason why the cost of health care continues to go up. According to the Centers for Medicare and Medicaid Services, the U.S. spent some $329 billion on prescription drugs in 2016. That's 6 times more money than the entire federal government in its budget spends for educating more than 50 million school children in America. Our federal government also projects that these costs for prescription drugs will continue to increase. Spending for retail prescription drugs is expected to grow faster than any other category of healthcare costs. Today, standing with Assemblymember Jim Wood, I'm very proud to say that we are working together to pass legislation to put another tool in the Department of Justice's toolbox to try to keep the price of prescription drugs down. Assemblymember Wood's legislation would make it possible to try to keep Americans in the reach of purchasing the drugs they need for their family and their children. Assemblymember Wood is going to talk about AB 824 and the reasons for it as well. But I simply want to say that I appreciate, and I know the people in my legal division appreciate, the help that he is providing through this legislation, if it becomes law, to make sure that we can go after those who are trying to keep the prices of prescription drugs higher than they should be. And I believe all Californians will appreciate that as well. No pharmaceutical company should be able to game the system at the expense of hardworking California families. This legislation would help us crack down further on these pay-for-delay agreements. And while pharmaceutical companies continue to believe that it's okay for them to split the profits of their collusion in these pay-to-delay agreements, it's unfair for hardworking California families to not understand the game that's at play. Californians should not be asked to pay higher, monopolistic prices for their drugs. They are robbed of the opportunity to pay for and to acquire the types of medication they need at lower prices in an open and competitive environment. Studies have shown that generic drugs, when they enter the market over time, they end up reducing the cost of the medication that Americans use by some 70 to 90% over what the price of those brand name drugs were. These agreements that we call pay-for-delay agreements cost consumers some $3.5 billion each year in higher health care costs. With today's legislation, we're announcing that it's our expectation that the California Department of Justice will be able to increase and expedite our legal challenges to these types of agreements. This legislation would make it clear that in certain circumstances, pay-for-delay agreements will become illegal from the start. It would also make clear that drug companies cannot simply withhold evidence as to what is behind these collusive agreements. I'm looking forward to helping Assemblymember Wood make the case for this legislation before his colleagues. We remain committed to do all we can to try to protect the health of all of our people in California and doing everything we can to keep the price of prescription medication affordable for all. With that, let me now ask Assemblymember Wood for his remarks.
First of all, I want to say thank you to the Attorney General for working with us on this very important topic. I look forward to this in the upcoming months, and I look forward to his assistance as I work with my colleagues to explain this challenge and do what we can to help reduce drug prices for Californians. First of all, good afternoon, everyone. I've been fighting against the high cost of prescription drugs since being elected. Whether it's creating transparency in price hikes, regulating the extremely profitable pharmacy benefit managers, or prohibiting the use of marketing coupons to keep patients on higher-priced drugs for longer when equally effective lower-priced generics are available. I've been there, not only to protect patients, but for those who feel the squeeze of ever-increasing healthcare costs. It's unfortunate that the egregious actions of some drug companies taint the entire industry. But when those actions continue to put profits over patients, we absolutely must act. We're here today to stop this calculating pay for delay. It's a scheme. It really is a scheme. Nothing quite tops drug companies that pay manufacturers not to produce lower-priced generics after their patent runs out. In this process, generic companies make money for doing nothing. And what do patients get? Nothing but artificially increased prices for drugs. These pay-for-delay agreements hurt consumers twice. Once by delaying the introduction of an equivalent generic drug that's almost always cheaper than the brand name, and twice by stifling additional competition when we know that when multiple manufacturers of generic drugs compete with one another, prices can be up to 90% less than what the original drug costs. Generic drugs have saved the U.S. healthcare system $1.67 trillion from 2007 to 2016. An FTC study concluded that the contracts that we're talking about, these pay-for-delay agreements, have led to $3.5 billion in additional costs to consumers every year. This expense is passed on directly to consumers, to health plans, the government, and taxpayers. Affordability is a critical issue in healthcare, and this calculating practice makes it worse, and we need to stop it now. Thank you.